Hi, I'm Lorelei Day with the City of San Angelo. Today we're here with City Manager Daniel Valenzuela to talk about COVID-19 in San Angelo. Daniel, thank you for being here with us today.
Thank you for the invite, appreciate it.
Absolutely. So we are almost 2 months into dealing with COVID-19. How would you say the citizens of San Angelo have responded to this pandemic?
I think for the most part, the citizens of San Angelo have really responded admirably. I know that it shows in the numbers that we've had. I know that moving forward, though, we still want to make sure that we're being cautious and we're being safe. One thing that we're highly recommending to our citizens as they go out, I know that the restrictions have been loosened, is to make sure that they're wearing masks when they're doing that. Now, that is not a requirement, but it is highly recommended. We just want to make sure that we do keep those numbers low and keep moving in a manner that we know we'll have control in the future. In fact, we do have some hospital admissions. But right now, that's what we're asking. But to this point, we really felt that our citizens have done a pretty good job. I know that going out to buy groceries, wherever it is, I do notice more people wearing masks. But I just want to make sure that even now, as the restrictions have been loosened, that that's something that we're focused in on. So let's keep up the good work, is what I would tell our citizens.
During all of this, I know that the city has been working with community leaders.
Yes.
Can you talk about what that entails?
Absolutely. It is a coordinated effort. It is not just the city that has a responsibility to ensure the public health and safety. We work very closely with both hospitals, with Shannon and community, along with the county, ASU, Goodfield Air Force Base, and all the other stakeholders to ensure that we have the resources necessary. In case, if in fact there is an outbreak where we have multiple hospitalizations, we want to make absolutely sure that we have the ability to address that we have the resources necessary. We worked on agreements with different hospitals, with different hotels, to ensure if in fact we ever end up with more capacity needs, that we have those agreements in place to actually put people in hotels and work with the medical professionals and maybe even having a floor where our medical professionals can go and provide that service, or at the very least to provide quarantine space for individuals who have tested positive. So we're working through all of that. We're also working through the Texas Division of Emergency Management with Jim Evans, our emergency coordinator, to ensure that we have the resources, whether it's the masks, whether it's, we talk about swabs, we look at just about everything, the testing kits. So we work very closely with the state on that as well. But our community leaders have been wonderful. I think that any time and every time that I've called them, they've been very responsive. I know I've gotten several phone calls from them as well. But again, with all of us working together, we'll get past this, and I think we'll get past it very successfully.
Now, as a city manager, how often do you personally talk with these community leaders?
Oh, it's constant. You know, this is on a daily basis. If I'm not on the phone with Shane Plymell, who's the CEO at Shannon, I'm on the phone with the county judge. It really varies, and it could be also our state elected officials or federal elected officials in an effort to secure more funding for the city. It is a constant deal. Every single day we're communicating, and that's really important, that we're communicating and making sure that we're all very clear on what needs to happen. I do hold every Wednesday I hold a meeting at 9 o'clock in the morning where I facilitate those group meetings with the hospitals, with all these different entities that I spoke about earlier. And that's just to provide updates, to find out exactly where the hospital is with its needs, the number of cases, to ensure again that we do have the resources necessary for those hospitals. I think they've done a really great job of trying to acquire some of those resources that they need. But again, we're there to help, and we're there to listen to find out what exactly the concerns are and see how we can assist them.
Now, looking at the numbers here in San Angelo of positive cases, they are relatively low compared to many other areas. What do you think can be attributed to that?
I think, again, it goes back to compliance. I think it's our citizens truly understanding that this is a serious matter. We want to make sure that we're not out there in public, that we're not actually taking this back to our loved ones, especially those that are at higher risk of suffering a serious condition and even death. You know, we see a lot of those citizens that show their love for their family members, for their friends, and they're doing what they should be doing. and that's staying away from those individuals. But again, as I mentioned a while ago, I still encourage everyone to continue that, to ensure that if you are spending time with family at your home, with those that live in your household, that you're still being cautious when you come home, but really ensure that you're not going out there and spreading that a disease to someone else, a loved one that quite frankly doesn't have the immune system to handle it. So again, we're very pleased with how our citizens have responded, but we again encourage them to continue doing that.
Okay. Do you think that the time in which San Angelo reacted to COVID-19 and placing restrictions, do you think it was quick enough? How do you feel about that?
I do. I know that the President of the United States on Friday, March the 13th, he issued his federal emergency. That was followed by our governor, who actually issued his state of emergency declaration. Actually, it was a state of disaster declaration that he issued on that Friday. Our mayor worked with Dr. Veredas, who is our local health authority, and Teresa James, our city attorney, and they really developed this declaration that she actually issued that following Monday, which was on the 16th. And hers was a local declaration of disaster, which restricted public gatherings, in social gatherings, to 50 or below. At the time, there were some cities that were limiting, but they were at 250. And really what the mayor wanted to do is make sure that we're following the CDC guidelines. So she acted really quickly to get that declaration order out there. But then the City Council followed up with that on the 19th, and they supported that declaration. At some point, of course, we did move from that 50 down to below 10, also following the CDC guidelines. So I think the reaction was quite quick, actually. There were still some communities that went a week past that still hadn't issued a declaration of some sort. So again, I'm thankful for the leadership that we do have in seeing how serious this could be, and understanding that those orders need to be out there, those declarations need to be out there. And I think she did a great job along with Dr. Veredas to get that information out there and get that declaration issued.
It's been said that government's hungry to take freedom and rights away. What's your comment to that?
I don't believe that to be the case, especially here in San Angelo. I know that here in San Angelo we are a conservative community. We do value our business, our enterprise, and we want to make sure that people have the means to be able to provide for their families, and that means businesses operating, having success as well. But we also know, in saying that, we also know that we have a responsibility to have public safety. So although we would like for business to continue operating like it normally does and prospering, we also know that we want to ensure the safety of our community. So there are times where we do have a responsibility to step in and make sure that for instance, as I mentioned a while ago, as far as the number of individuals that could gather with the initial order was 50, then it came down to 10, and then it was reduced to that. And it's based on what the numbers are showing. For the state of Texas, the numbers were higher, not specifically here in San Angelo, but I know the governor issued his executive order that was sweeping, and it really was for all the communities in the state of Texas that we had to follow. But on our end here in San Angelo, we want to make sure that we never restrict the freedoms of our citizens, especially our businesses as well. We want them to operate successfully, and it's a careful balance. I think that if we had more authority at the local level, we could create rules specific to our area, and that's something that we'd like to see in the future. But right now, we are in compliance with the governor's executive order.
You mentioned public safety. Can you talk a little bit about how right now it's going past just providing police and fire services, it's turned into health services as well?
Sure, absolutely. Well, again, as I mentioned, health, it's not public safety alone, but it's also the health of our community. We've done numerous things, and of course we work with our health inspectors, our code enforcement officers, to ensure that those orders that have been issued by the governor are being followed, whether it's visiting right now different restaurants to ensure that they are following those guidelines. We want to make sure that we're doing that. Again, there's a reason why those orders are issued. We may not always agree with some of the orders that are issued, but we know that we're supposed to comply. So we are working toward improving the health and safety of our community. So it's not just that, you know, I think that what people also don't realize is that we still had crews out there working, of course, albeit with caution, but they're still repairing our roads, making sure that we're safe in that manner as well. You know, we still get calls about potholes and what have you. But again, our health is important. We have Sandra Villarreal, who's our health director, who I think has done a really good job of making sure that we understand some of those guidelines that should be followed. And of course, are working closely with the hospital and the medical professionals. They also give us a lot of guidance as far as what we should be doing as a community. And we're very careful to follow those guidelines as well. And again, I do want to thank Shane Plymell, the CEO of Shannon, and also Rod Schumacher, who is the CEO of Community Medical. They've been wonderful in working with us and helping us to understand the needs of the community when it comes from medical and health. And we work very, very diligently with them, I think very successfully with them as well.
So with all of these restrictions in place by the governor and local, can you talk a little bit about what impact this is going to have on our local economy?
Mm-hmm. It's going to have an impact. You know, it's kind of a double whammy. You know, we know that oil and gas industry has really crumbled at this point. So that's going to have an impact on our sales tax revenues. Sales tax revenues, that's the highest revenue generator for the city, next to property tax revenues. So we know that right now, even the property tax revenues that we bring in isn't even enough to really pay for our public safety, which is our PD, our firefighters, our EMS workers. So it has to be supplemented along with the other services through another tax revenue, and that's our sales tax revenue. So we know that it's not just the oil and gas, but especially with COVID-19, this is something that for us is unprecedented. You know, we do our best to forecast for next budget year to make sure that we have the resources needed to cover our expenditures, and of course we look at revenues versus expenditures. So we're having to adjust that forecast in the future for next year because there's a lot of uncertainty as far as what's going to happen with this COVID-19. We know that even now, this fiscal year, I've already moved to freeze hiring positions. We're looking at cutting, and we've already started cutting expenditures for the city. My goal, of course, is at the end of the year, and the city council and the mayor's goal as well, is to make sure that we are in the black, that we're doing everything responsibly. So we've always done that. We've always been conservative in the way that we look at our budgets, and that's something that we're doing right now. You know, we're making sure that we cut back and that we ensure that the services that are needed for our community are still there, but we do it in a very, very fiscally responsible manner, especially now at this time. But again, it is going to have an impact on our sales tax revenues. It's going to have an impact overall on the revenues that come into the city. So it's going to be a challenge, but it's a challenge that I know we can meet.
So speaking about our current situation, with the governor's orders, can you address what that means for local authority here?
Well, as I talked about a while ago, the governor's order, it really applies to all the cities of the state of Texas. I know that we developed a plan, a local plan, that we felt would have better served our community. And it was based on the hospitals, how much capacity they had as far as admissions into the hospital. We worked very closely with those medical professionals to develop a plan that we felt would really support us locally better than anything that could be issued from the state level. We did submit that to the state. However, I know the governor at this point, I think he's trying to have control over how some of the communities are handling in response to COVID-19. I think some are taking it much more seriously and you show it, you see it in how the community responds to this COVID-19. Well, our numbers have been relatively low. But we also felt that we could develop a plan based on those numbers that would work better for our community. However, with that said, we are supportive of our governor. He did issue those executive orders, and we're going to comply, of course, and make sure that our citizens, our businesses are also complying. I know it's tough on everyone. I wish that we could return back to normal. But at this point, it is important that we do follow those executive orders that the governor is putting out there.
Mm-hmm. I think we all wish we could return back to normal, but
absolutely,
I'd say that we're doing a great job as You're doing a great job as city leader.
Well, thank you. I appreciate that.
Is there anything else that you wanted to add?
No, just really, I want to just give my gratitude to the local leaders, everyone that's come together, of course our mayor and our city council, our county judge, just everyone that's working really closely together. Our staff, I think our staff has responded admirably. I really appreciate all that everyone is doing, the adjustments that have been made, some working from home. Others, we put them out there working in different areas where we need more support. But I think that overall, everyone's reacted in a manner that I am very proud of. And we hope to continue working in that manner as well. And again, much appreciation to our staff.
Well, Daniel, thank you so much for being here today, and thank you for all of your work. I know it's a round-the-clock job, especially right now, so we really appreciate it.
Thank you, Laura. I appreciate that.
Absolutely. For more information about COVID-19 in San Angelo, visit cosatx.us/COVID-19.